Well, we should all appreciate when we are breathing effortlessly. This marks our topic of discussion on this Healthy Monday, looking at respiratory diseases with the help of an expert who I'll be introducing in a few. But just to let you know that you can send in your questions, comments via our SMS line, that is 0111220044. Remember, we are also coming to you live on all our social media pages, that is Kirk TV Kenya on Facebook and YouTube, Twitter at KirkTV_Kenya, Instagram KirkTV.Kenya. Welcome, my name is Aida Munzati. Remember, this is the Kirk TV Partnership Week, and today we've been discussing all matters health, and on set right now, I'm being joined by Nurse Joanne Kagema. Joanne Kagema is a senior nurse at Kenyatta National Hospital, as well as a respiratory disease expert. Joanne, karibu sana, and thank you for creating time so that we can learn from you.
Thank you very much, and I am grateful, and I cannot take it for granted to be in Kirk TV, because that is where I belong, being a Presbyterian, to thank God for everything.
Thank you so much for creating time.
Yeah.
So just to let our audience have a basis or an understanding of what exactly we are going to be discussing this evening, what exactly, when we are talking of respiratory diseases, what exactly are these?
Respiratory diseases are many. It's anything that affects the lungs. It's anything that affects your breathing. That includes even TB, it includes asthma, even COVID is part of the respiratory disease. There are many diseases like fibrosis or complications of TB after you have taken for long and you didn't take well. You get TB, bronchiectasis of TB, fibrosis. You can get interstitial lung diseases. There are so many diseases that affect lung. There is the COPD, which is because of either people have been smoking or you are a passive smoker. You may be smoking literally, but maybe you are a passive smoker. Like Akina Shoshos and our mothers did cooking with the charcoal and the firewood, but they smoked. They took that smoke, and then it bring issues later in life. So areas of respiratory, the lung health is wide. But I will trickle on something that people have been really feeling that they don't really like it to hear about it. It has got a lot of stigma, and that is asthma. Because if today you are told that you have asthma, what is your reaction? If a mother is told that the child is having asthma, what is I saying? No, in our family there is no asthma. All those things. And then the types of the drugs that we give, people start to think, no, it cannot be that. So some of those things we need to discuss. They are part of us. You can get them whether you are young or old. In between, you can get it. Yeah.
All right. So you just mentioned a few of the
lung diseases.
Exactly. So before even looking deeper into these, let us look at asthma, as you've mentioned. What are the symptoms? What will tell me that my child has asthma or I have asthma?
In most cases, the very important thing is about when you come to me, maybe you come with the complaint of that I've been coughing, or you are wheezing. Or sometimes you wake up at night. And then when you wake up at night, and then you start sneezing, that kind of fog. So that one can give you the part of the history. Or whenever you go to a place, and then you get some sneeze, like the allergies. And there are people who pass through the flowers, and they start coughing. Or where somebody has got very strong perfumes. You even fail to breathe. Because it is affecting you. So those are, and then there are others that can be affected because of their occupation.
And is there a particular age or one can acquire, let me say, asthma or any of the respiratory diseases? Is there an age where one can acquire, or at any stage of their life anyone can acquire?
For asthma, you can get at any age. And it can be either family history. You may have had that history in the family, but you can also get it as an adult, even at the elderly, and even children get them, not the small one, the young children, because the children maybe have because of some and then outgrow it, but later they can have it, and even in adolescence, in teenage. Yeah, but the other lung diseases, there are many. It depends. Like if you have been a smoker, you can get a condition that is called chronic obstructive pulmonary disease, which affects most of the smokers, all those who are passive smokers like our mothers and our shoshos, because they have been using a lot of charcoal and firewood. So some of those, they may appear even later in stage, or even when you are young, especially the young boys, the young men that started smoking early. Sometimes they affect that. TB anybody can get, whether a baby, a child, old and young. TB you can get anytime. Anytime. Yes.
Okay. Now, looking at all the respiratory diseases, are they transmittable? I know TB is transmittable, maybe through the air, but are the rest of the respiratory diseases transmittable?
No, apart from COVID.
Okay.
Because
How
COVID
about
is still
tuberculosis?
Tuberculosis, it's infectious. In fact, actually, we put it in an infectious disease area because you can transmit it. But there is other TB that you cannot transmit, because if you get TB from the brain, that is not transmittable. Okay. If you get the TB of the bones, that is not transmittable. If you get the TB of the stomach, of the pelvis, anywhere, that one not. But when you get the TB of the lungs, that is transmissional. That is infectious. Yeah, that one that comes in the lungs. Yeah. But you can also get even TB of the adenoids. Yeah.
Okay. And looking at all these respiratory diseases here in Kenya, what is the prevalence and which one would you say is more common? Maybe let me say in children and in adults, or generally, what is the most common in Kenya?
You see, the problem, the issues that we have, is lung health is non-communicable diseases, apart from the TB. TB, we put it in infectious, but the other lung diseases are non-communicable diseases. And anybody can get, like interstitial diseases, even a child can get. Either before, when they was being born, or even later. The things that happen because of the DNA of how we, because when you come out, you don't know how you have been, the way you have been put. But it's very important that, like there is a high prevalence in asthma in this country. It's only that much has not been done, like studies. There's a lot of a high prevalence even of COPD, which has not been studied. So studies is the one that can tell you the prevalence in the country. But in the world as a whole, in every 10 people, you can get an asthmatic.
Okay, now being an expert in or a respiratory disease expert, probably let's say in a day at your workplace, let me assume at the Kenyatta National Hospital, how many people do you see a day that you will say have asthma? Or any of the respiratory disease?
Asthma, we need to take a little down on asthma, because asthma is common, and especially in this weather. Many people are flared up, they are wheezing because of the cold or something of the sort. Either they have been mold and other things that you have breathed something that has even triggered the asthmatic. Maybe there's that time the person has been remaining normal, and then all of a sudden, because of the change of the weather, the environment, then it has triggered. For me, I'm a respiratory nurse who educates a patient on management of lung health, management of how to take care of yourself, how to use the right treatment, and how do you do the treatment that you have given. Because most of the medication that is used mostly in the asthma and COPD is inhalers. And those inhalers are the ones that are an issue even for people to use, for clients to use, and even for health workers. Most of them may not be knowing the types of them and how to use them, so that you can be able to teach or to demonstrate to a patient or to a client to know, so that he can be able to breathe. Because the minute you are not able to breathe, there is a problem. And you need to be healthy, to be able to, you need to breathe to remain healthy. Because if you are not breathing, you can imagine how you feel. Yes, that is it. So in asthma patients, there are many, and like this, they are very flared up. So they are not very many, because for those who are well controlled, they are taking their treatment well. they are followed up in the clinic. Those ones, they have no issues. And that's when you get a small infection that can make it to flare up. Yeah.
Okay, so you've just mentioned that this cold weather affects people with asthma, yeah? How about when, let me say, maybe dust? Does it also affect them?
Those are what we call triggers. Like cold is a trigger. Like dust is a trigger. Perfume is a trigger. When you're keeping pets, because there are families who keep pets, the dogs, the cats, you may even have the horses. There's some who have even those. Then you may be having flower farm, some flowers. There are people who are affected because of the pollen that comes from the flowers. The people who are farmers and they have numbers, the cows at their places. What happens? They get the napier grass. What does the napier grass have? It has something that comes out. And if you breathe it, it's something of a, so it depends what really triggers your attack. So different people have different, So there are some who can go to a dusty place and don't feel anything. But the others will go to a farm where there is flowers and they will not be able to breathe. So it's about the DNA of person. But always understand yourself. What triggers you? Because what triggers for me is not what triggers for you. So you need to understand your body well. Yeah.
And is there probably a common trigger for that cuts across probably?
Most people, most maybe is because of mold. When you find that the wall is really coming out some fluid and something like that mold is very common. And also we did a study some years ago, and we realized that people react to house dust mite, which happens from the carpets that we put in the houses. So you find that somebody, whenever he gets into the house, he keeps on coughing. But when he's on outside, nothing. Okay. It may be because there's a carpet in that house, or there's a mold. Like when the paint is peeling up from the bathroom, your walls, around the floor, that kind of thing. So those are the things. So it depends on who. Yeah, because you cannot say it's across. You cannot cut it across because different people react differently. DNAs are different. Yes.
Okay. Now, being a nurse, you've just mentioned of how key it is for now health workers or nurses, or let me say doctors, should administer an inhaler to a patient with asthma. How important is this, and from where you sit, how should it be administered?
What happens is the doctors prescribe the treatment to the patient, so the pharmacist dispense. So how do the patient get that medication to learn how to use it? That is where I come in. Because the patient has to learn, because the dispenser only gives you the instruction. But from that place, how do you learn it? It's not like that you take the tablets form, that you take one tablet morning and evening. Or one tablet morning, lunchtime and evening. This is a device that you have to use it well, so that it has an effect to your breath, to your lungs, so that you cannot feel the heaviness, so that it can reduce the shortness of breath, so that it can open the airway. And how you administer that is it. So there are different devices that are given to patients. Some of them I came with them, with some I didn't carry them. I forgot. There are different devices, because when it comes to a child, how do you demonstrate that medication? If it will come to an old person, how do you do it? To a young person, middle class, how do you do it? Because every person has got his own need and the preference and how to demonstrate. Because if you're to a baby, you'll not be able to demonstrate like an adult.
True.
There is a ways on how you do it to a child. If it's an infant, how do you do it? So you should have either a mask and a spacer. If for a bigger child, may be used on a spacer alone with the medication. For the people who we call them special groups, the special groups are the people with special needs, the people who have mental issues. How do you demonstrate? Because lung disease can affect across the board. whether you have any other condition, whether you are diabetic, whether you have cancer, whether you have mental issues, whether you have any other condition, anything to do with the lung, it cuts across the board. So you have to be well conversant on how to manage the patient and then also to give him the treatment. So if a diabetic has got if somebody who has diabetes and he has an asthma, should be managed well for diabetes. Then he comes to us and then we continue with the lung issue and demonstrate on how to use the medication. If somebody who is going for cancer treatment, you finish the cancer treatment, comes back with help with the sort out the issues of the lungs, because every area has got a speciality. Yeah.
All right. So you've said you'll be demonstrating to us probably how to use an insulin, you mentioned.
Not insulin, I'll be using the issues of the inhalers.
Yeah. All right. So let me say you've just mentioned of the stigma that comes with asthma. Yeah? Let me say that how do we create awareness to the public, or how does someone in the public know that this person is having an asthma attack, and how do they handle this person?
Let's come back again. The issue of stigma is about using the inhalers, and also the issue that why are using the inhalers, because in asthma management we don't use tablets, but you go outside there, you find people buying tablets to take it in the pharmacy. They either buy something called like Flano, something like called Sabutamol tablets or Ventolin tablets. Others, the Sabutamol tablets, others you go and buy prednisone tablets, which is not right. In a well set up, because whatever disease that we treat or we take care, there is always a guideline. There is always a guidance that guides in management of any disease, be it cancer, be it diabetes, be it any other disease, including even asthma. We have an asthma guideline that guides us on how to manage asthma in both adults, children, and the special groups. And they also, even for you to know whether you have an asthma, there are other tests that we do. It's not only we do proper history taking. You need to do a history taking. Once you do a history taking, then you can do what we call functional assessment test. That one includes the lung function test, or you do a peak flow to assess how the lungs are behaving, the volume of the lungs. That is how you assess. So when you combine the history and the test that you have done, and maybe you can do maybe a blood test, and maybe sometimes a chest X-ray, then you can combine all those things to come out with an answer. So it is important that once you have been seen by a doctor, and then you need to get medication, and then you are taught on how to use, especially the inhalers. They come in different colors, they come in different forms, they come. So we don't talk about the. I'm not here to promote anyone or anything, but they are different. Some come in a circle, some comes with a camera spray, the others comes with like something like we call a turbohaler. The others come in different form. So somebody, whoever is seeing, somebody has to be conversant on whatever is in the market and how to use it. Because if I give you a prescription and go to Accra Road and buy, somebody should sit there and train you and teach you on how to use it.
All right. Thank you so much, Nurse Joanne. And just to our viewers, feel free to send in any questions or comments to Nurse Joanne. She'll be happy and glad to respond to them. Send in your questions to 0111220044. Remember, this is Healthy Monday under the Kirk TV's Partnership Week. So we'll take a very short break. When we come back, Nurse Joanne will just be taking us through the different inhalers, as she mentioned, and how to use.
We welcome your feedback on our programming. For questions or comments, kindly get in touch with us via email info@kirktv.org, SMS 0111 220044, or call us on 0794 588 054. Are you ready for Israel? PCEA head office is pleased to inform all presbyteries, parishes, churches, congregations and friends of our PCEA annual trip to Israel. The 10-day trip to the Holy Land will happen this September from the 18th to 27th, 2022. The trip to Israel through Egypt will include visit sites like the pyramids, Mara, the Hayin Church, the Burning Bush, Mount Sinai, and then to Israel through the Suez Canal. That will include visits to the Dead Sea, Kibbutz, the Menja, the Temptation Mount, Gethsemane, Old Jerusalem, Caesarea Park, St. Peter's in Galligantu, Emmaus, Capernaum, Jordan River, Galilee, among others. We would love to have you join us on this annual trip to Israel. For bookings, contact Rose on 0721 511 524 or 0721 511 524. Are you ready for Israel? PCEA head office is pleased to inform all presbyteries, parishes, churches, congregations and friends of our PCEA annual trip to Israel. The 10-day trip to the Holy Land will happen.
Well, you're welcome back, dear viewer. Remember, we are looking at respiratory diseases, and with the help of Nurse Joanne, we've just narrowed down to asthma. And before taking the break, I just mentioned that Nurse Joanne will be taking us through how to use the different inhalers that are in the market. Feel free to send in your questions and comments on our SMS line, that is 0111220044. Remember, we are also coming to you live on our social media pages, Facebook and YouTube at Kirk TV Kenya, Twitter at KirkTV_Kenya, Instagram KirkTV.Kenya. So, Nurse Joanne, you can take it away. Just show us over how to use the different inhalers that you're able to carry with you.
There's one that we call Tabuhela. There's one that we call Discus. There's one that I forgot that is called the meter dose inhaler. That one that goes like a spray.
The common one that
people know. So these one are some of the drugs that we have, and there are others in the market. And then for the elderly and maybe for the babies, we use this one and with a mask here. We use the one that normal common one, we use it here and a mask here for the small babies. For a baby who is about 6 years, he is able to take soda with a straw or juice with a straw, then he can use without a mask. And this is what we call spacers. So there are different types of spacers in the market, and they are different. And for the children, we go with the age, but for the adults, you can use this one. They are more different. They are more different in the market, and so we have several of them. So, and the other thing that I would like to tell the audience, that even when you are using an inhaler, it does not mean that you are an asthmatic, because lung diseases really respond to inhalers. Because what we really need to ensure that you are able to breathe, that you are able to climb the stairs without getting tired, you are able to walk a distance without even resting in between, to ensure that your airway is there's good air saturation. And that's why you find that these days even before the COVID came, we used to do a pulse oximeter to our patients, because in any condition that affects lungs, it affects your oxygenation. It affects how much air you can be able to breathe. So sometimes when you are not able to breathe, your oxygen saturation or the level of your oxygen goes below. So we have to monitor it up. So sometimes we can give you an inhaler, and then your oxygen levels gets up, and then when you maintain like that, then you're able to do the normal duties, you're able to live a normal life. You don't have even issues of stress. So it doesn't mean that when we are giving inhalers because you're an asthmatic. No, it's because you want to take care of your lungs, because it responds, because the medicine that is in these gadgets, it does not go through digestion and then it's absorbed. It goes directly to the lungs, and it works very well. It works very well when it goes like rather than when you take tablets, they have to go be swallowed, then it go to digestion and then to absorption.
By the time it's working.
Yes. So this one you can use it. And it is important when you know how to use it, because even in case of emergency, you'll be able even to take care of yourself. Yeah.
So other than taking care of yourself, you've just mentioned of the common inhaler that you forgot to carry. Since it's the common one that is used, let me say, by a number of people, just let me say demonstrate. I'm sure a number of us have come across it, So I see some shaking, spraying, maybe
those were there, In that one, you need always to shake it. And especially there's this one that people keep on buying it, Ventoline or Salbutamol, that brew can, that brew canister. It is good, yes, and it is the rescue medicine. We call it rescue medicine, because the other that comes later, they are the preventers. So it depends on which one. The brew one is usually the reliever. It relieves the symptoms. It makes you to be able to breathe. But according to the latest GINA guidelines of 2019, 2020, 2021, and even now that we're in 2022, the brew inhaler, or the salbutamol, as we call it per se, should not be used by the adolescents and the adults. So what we need is to use is a medication that has got an steroid in it that can stop the inflammation, because asthma is about the inflammation process in the lungs, because there's inflammation around the lungs. So you take that one that has got a steroid, or one that has the two combined, because there is the second one which has got either the white or the red, or some kind of a yellow color. If you had the pictures, I could have done that. So that one will help you to because the one relieves the symptom, but this one stops the inflammation, because you can relieve the symptom in the next 30 minutes, 1 hour, you're in the same attack. So you have to stop the further inflammation process that happens in the lungs, so that you can maintain it and you can be able to function normally. But if you continue taking the brew one continuously, you keep on, then what happens? You continue messing with your lungs, because only what you get the relief, but after that we don't stop that inflammation. So our drugs of in the setups that we are in, it's a combined. It is what we call long-acting beta-2 agonists with the ICS, what we call inhaled corticosteroids, that is used to help that you can be able to relieve yourself, to open your air, at the same time it stops inflammation. So that is what we call a combined inhaler, which is like this one is a combined one. This is a dummy. It's not only medication. This is not dummy. But when it comes in the market, when it is combined. It is combined, so that you can use it as the symptom stops the inflammation. So, and this one is a good one, because you can use it whether you are in attack or not attack. But this one that are combined, we usually do them morning and evening. Morning and evening. And most of the time, because it's dry powder, we tell our clients or our patients, rinse your mouth with water or whichever type of water you're using, and then you swallow. You rinse and then you spit it out, and then you swallow. To avoid what? To avoid having thrush, or what we call candidiasis, or COVID disorder in the line of the swallowing. Or you can get a reflux, a GERD, or where you feel that the people call it kirungurira or unachomeka, that kind of thing. To avoid those things. Those are some of the side effects. But when you take it well, It is the super. It is super. So you have to do that morning and evening, and then you do those to prevent even the hoarseness of the voice, because that is what we call dysphonia. So you have to reduce that kind of thing. So when you are taking a combined, you have to make sure that you are in the morning and the evening you have RIS. There are others that are very good that we call them smart therapy, that you can use it even when you get an attack in between. You can use it.
All right. So as we wind up, you've shared or you've just explained to us the number of inhalers and how to use. Let us just look at very briefly how accessible are they, and probably let me say just for the sake of the asthma people outside there, what can the government or the ministry do to make inhalers accessible? They are very available. Like in where I come, there are all various of types of the inhalers. In the private sector they are, and even in the county government hospitals. How cheap are they?
For this and this, they are not cheap. There are others that are, as you can see, because they look nice and you don't need to strain, because the one that you do normally, you have to breathe in and out, you have to coordinate, but this one, they don't require coordination. You have to coordinate, you breathe out, breathe in. As you take a deep breath, you have to inhale your medication. But for this one, you just open and then you just inhale, and then inhale for 10 seconds. So those are the things. So every device has got its cost. The more it is easy to use, the more expensive it is.
It becomes.
Yes. And even for our elderly patients, our shoshos, our small babies and whatever, you have to add this as spacer, so that you can be able to help that child or that person to take medication, so that they can be able to reach in the lungs. And for the children who are using the mask, they have to clean their face with soap and water to avoid that powder to stick in there. So because most of the time, if you don't clean their face, they come with the skin becomes lighter, they become browner. They were darker on the area the mask that was. So those are the few things. So the next time when I'll come, I'll do a better demonstration and even how to assess a person with it. And some of the things like what we call that, the diabetic patients usually have a glucometer to monitor their sugars. People with asthma and lung diseases, they need to have another gadget, such a gadget to help them to monitor their lung conditions.
All right. You're speaking very passionately of asthma and respiratory disease. Maybe just one word or a parting shot to our audience about the same. Very briefly. Yes.
Nobody should stop using inhalers. Inhalers is not about the asthma, it's about ensuring good breathing. It's what we call kupumua. You have to breathe easy. And that is actually is what I believe in, breathe easy. Because if you don't breathe easy, you're in trouble. So when we tell you to use an inhaler, please come, just come and use it. If you don't know, our doors are open. You can always come, you can always reach me, you can always get my number, and you can walk the journey together. Even for both children, because sometimes mothers get through frustrations, but when we talk together, you come out with a solution.
Easier. All right. Thank you so much. That was a senior nurse at Kenyatta National Hospital, Nurse Joanne Kagema, as well as a respiratory disease expert. Remember, we were looking at respiratory diseases, and Nurse Joanne has explained it so well and in a layman's language for everyone to understand. Remember, we have narrowed down to asthma, and if you're just joining us, you can always find the recording on our social media pages, Kirk TV Kenya on Facebook, as well as YouTube. Remember, this is Healthy Monday. We will be discussing more of our health issues and health matters in about 15 or so minutes, where I'll be engaging administrators and other experts from Tumutumu Hospital, Chogoria Hospital, and PCEA Kikuyu Hospital. So keep on sending your questions and comments through our SMS line, that is 01112220044. Remember, the hashtag to use is Tujenge Kirk TV and partner with Kirk TV. My name is Aida Munzatsi. See you again in a bit.